Since 2021, the Accelerated Access Collaborative Asthma Biologics Programme has brought together stakeholders and organisations involved in severe asthma care together to improve pathways, to improve access to asthma biologics and ultimately improve outcomes for patients with severe asthma. Over the last 2 years, we've seen some amazing impacts and also supported a number of really interesting, innovative models of care that have shown real promise locally in transforming care, but also that we hope will be able to be adopted and spread further afield.
I think ultimately everyone here is really keen to improve the care of people with severe asthma, and that came out loud and clear today. People wanted to work together, people wanted to do things better, and people are really keen on sustaining all of the positive change that's happened over these last few years. So I think if you ask me what the key points from the day were, I think they were collaboration, I think they were earlier identification of patients, and sustaining the positive change.
Certainly one of the things I'm most impressed with is how we've understood what the problem is. We've all come up with sort of slightly different solutions to that problem, but we're all moving in the right direction and we're all trying our best to kind of get to that utopian, all our patients who are eligible for a biologic receive it in a timely fashion.
Through the work that we've done in the last 12 months, we've managed to work with 42 practices. I personally have reviewed just over 800 patients, and we've referred 200 patients into secondary care for asthma biologic consideration.
We redesigned our asthma service to provide primary care in reach to get more people onto biologics sooner, secondary care in reach to get more people onto biologics sooner and to smooth the referral process, and also tried to free up capacity by remotely monitoring people that were going on biologics. We did this to increase capacity at the severe asthma clinic and get more people on medication that can hugely improve their lives. My advice would be to other people that want to do this is to do it as a rolling program. So to kind of embed risk stratification in primary care and build up those links with primary care and keep doing it rather than doing it as a snapshot.
The aim of the project was to make asthma care a little bit more equitable, or health information around asthma to be more equitable, and to make sure that people understood A, what poorly controlled asthma was, and B, that there were advanced treatments to help. But also what's been really wonderful is to see some stories from people who've been very, very generous in their time and let us know stories about a high-risk pregnant patient who weren't sure about taking a medication in during Ramadan. We've had stories, actually messages that I put out in the mosque and the community workshop coming back verbatim in my own clinics. It's obviously something's happening and it's working, and it's been very, very rewarding. And the biggest thing for me is that I'm able to give more equity of care. So if somebody comes to my clinic and doesn't speak English or read and write, I've now got the ability to signpost into information that's readily available. And as a clinician, that's been really, really important to me. Not to be complicit with these difficult systems, but to empower. I felt very empowered through this Pathway Transformation Fund to make change.
Mainstay of our project, three big arms. Big arm number one, it was trying to get out to 9 PCNs, send out highly specialised pharmacists to search for and find complex, difficult asthmatics, and then fast track them through the hurdles straight onto biologic therapy. Number two, we wanted to kind of get FENO out there a bit more. We historically, where I am locally, we've had a very low use of FENO in primary care, and thanks to partnership with the AHSN, particularly our Oxford team, we're really thankful we were able to have a carrot of offering every PCN that came with us a free machines to take away, and we do some training, and yes. And then number three, we use this to really strengthen our spokes to our secondary care colleagues, and they were the three big aims, all of which was really focused on how do we make sure the asthma patients who really need it get these life-changing therapies quicker, more efficient, better, yes.
Came here just to learn more about severe asthma, what other people are doing in different parts of the country. It's so great to see hear all the other projects, what everyone's doing, the collaborative work and the key integration with primary care. And I think big take-homes are about utilising your MDT as much as you can and utilising links with primary care and really trying to find the patients that we need to get onto biologic therapy and improve patient outcomes thanks to Key.
It's made such a difference to the patients because, you know, historically before the project, these patients just did not have access to these treatments or these services. So the fact that these patients are being picked up and they're being started onto these treatments has a massive impact, not, you know, on their quality of life. They're not living in fear of having exacerbations. Yeah, it's made a huge impact on them.
So what will stay, I think, is the change in mindset and the change in culture, and the sort of new pathways that we've established, even if it's something as simple as a paper form, which is saying, please tell me A, B and C about your patient, about their adherence, about what medications they've tried. It's all time saving, and it's the patient's time that's being saved as well. So hopefully they come to see us once and we get them rapidly on the biologic that they need.
One of the other really great things I think I took from today is about sort of access and how, you know, we say like, well, our patients are hard to access. We can't get hold of them by phone, they don't answering, they don't come to clinic when they write their letters. But is it that we're making ourselves too hard for them to access? And I think that's something we want to think about. How do we take ourselves to our patients rather than expecting them to come to us? And that'll take a bit of thinking, and it's more than just integrated care, because it's more than that. It's trying to get the specialists out to patients. And I think that would be what we will have to focus on over the next few years.
If you're interested to learn more about any of the projects that you've heard about or the wider Accelerated Access Collaborative Asthma Biologics Programme, then do head over to our comprehensive Asthma Biologics Toolkit.